Have you ever had a backache after a long day? Trust me, I've been there. But how do you know when it's more than just a pain in the back? 54.4 million US adults have some form of arthritis, and that figure is projected to reach 78 million by the year 2040. Here's what you need to know your body. About 80% of back pain is acute, caused by some type of injury, such as lifting or bending improperly. Treatments for acute back pain include hot and cold therapy and anti-inflammatory medications or muscle relaxers. If pain does not improve within a couple of weeks, it's considered chronic, and it may be caused by arthritis, which is the inflammation of the joints. Did you know that there are 100 different types of arthritis? The most common type, osteoarthritis, affects over 32 million Americans and typically begins around the age of 50. As you age, the cartilage in your joints breaks down until your bones rub together, which leads to inflammation and pain in the lower back, as well as the hips, knees, and hands. Women are more likely to develop arthritis due to hormones, but age, obesity, injuries, and family history are also risk factors. We're here with rheumatologist Dr. Ashira Blazer. What red flags should people look for in separating typical back pain from arthritis?
I would say if you're experiencing back pain regularly, so more than once a week for more than 2 or 3 weeks at a time, if you have stiffness for more than an hour in the morning time, if you're waking up because you have back pain, also any neurologic symptoms, any changes in your bowel or bladder related to your back pain, that has to be talked about immediately.
Absolutely. So is there anything people can do to prevent arthritis, or are we all just gonna get it eventually?
Not necessarily. Osteoarthritis can be prevented, usually through movement and healthy diet. So we know that keeping a healthy body weight is really important for protecting our joints, including our lower back. When we're talking about knees, every pound of weight on your body puts about 4 pounds of pressure on your knees. So even small efforts in weight loss can actually have a big impact on our joints. One of the biggest causes for osteoarthritis progression is injury. When we're young, we're very active, we can have injuries, and often we don't go to physical therapy, we just sort of keep moving, right? Making sure that our joints are moving well and that we're healing after those incidents can prevent us from having osteoarthritis later on in life.
Yeah, that movement piece is crucial. But what's your best advice to people out there who are struggling with arthritis?
My best advice is that you should not be afraid to keep moving. Often my patients hear, this is wear and tear arthritis, and so the more I move, the worse this is going to get. And that's actually not true. Continuing to move, getting physical therapy is going to be really key for living well with arthritis. Keep moving, don't be afraid. Your body is not going to fail on you.
I hear you, keep moving. Thank you, Dr. Blazer. Osteoarthritis symptoms can be managed, but damage to the joints can't be reversed. Anti-inflammatory medications, physical therapy, staying active, and maintaining a healthy weight can slow progression of the disease, reduce pain, and improve joint function. Now you have the tools to know your body.